Okay, hello everyone. My name is Daffa Dzaki Syarif, and today I want to explain the chemical that I picked that I choose is a calcium hypchlorite, also known as a Kaporit. And this is commonly used in the daily life, especially for water disinfections. And as you can see at the poster, calcium hypochlorite has the chemical formula CaClO2. It is a white solid powder with a strong chlorine-like odor. And this chemical is mainly used for the water treatment, swimming pool, sanitation, and water purification because it's very effective in killing bacteria, virus, and other microorganisms. Now, talk about the hazard at the number two. Based on the hazard identification sections, calcium hypochlorite is classified as a strong oxidation agent, which means it can intensify fire even though it is not directly flammable, and it can also cause irritation to the skin, eyes, and respiratory systems. Another important hazard is that when mixed with acids, it can release chlorine gas, which is very toxic and dangerous to inhale. That is why this chemical has several GHS hazard symbols, such as oxidizers, irritant, and acute toxicity. And you can see the hazard is in the poster at number two. And then next we look at the number three, health effects. The calcium hypochlorite comes into contact with the skins, and it may cause redness, irritation, or even burns. If it enters the eye, it can cause serious eye damage. If it inhale, the dust may irritate the nose, throat, and lungs, making it difficult to breathe. And if swallow, it can be harmful and may cause nausea, vomiting, and stomach pain. So, what should we do in case of exposures? For a skin contact, wash the affected area immediately with water and soap. For eye contact, rinse the eye carefully with the clean water for at least 15 minutes and seek medical attention. For inhalations, move the person to the fresh air immediately for a good ingestion, and do not vomiting, and get medical help as soon as possible. And then the next one, discuss about the safe handling and storage. Calcium hypochlorite should be stored in a cool, dry, and well ventilated place, and it must be kept away from moistures, acids, ammonia, and flammable materials because these substances can trigger the dangerous reaction. And the container should always be tightly closed to maintain stability. When handling this chemical, it is important to wear a proper personal protective equipment or PPE like glove, safety goggles, masks, or respirators and protective clothing. And PPE is essential to reduce direct exposure and prevent injuries. And this is the number eight for exposure controls and personal protections. And then we move. The area should be evacuated if ventilated. Avoid creating dust. Collect the spilled material carefully and dispose of it properly according to chemical waste regulations. And in conclusions, this calcium hypochlorite or caporit is very useful for keeping the water clean and safe, but it also has a significant hazard if not handled properly. By understanding its risks, using a proper PPE, and following safety procedures, and we can use this as chemical safety and effectively. Thank you. That's all for me. Good afternoon.